Good afternoon, everyone, and welcome to our World AIDS Day event 2020 virtual panel discussion. The title of today's event is Echoes of AIDS in the Time of Coronavirus, Lessons and Reflections. Our hope is to explore some of the connections between our current experience with the COVID-19 pandemic and our early and ongoing response to the HIV epidemic. My name is Dawn Fukuda. I currently serve as the director of the Office of HIV and AIDS at the Massachusetts Department of Public Health, and I'm pleased to join you all this evening for this event. On a personal note, I am genuinely thrilled for the opportunity to facilitate this discussion. I have had the pleasure to know each of our panelists and our special guest speaker for many years now, in most cases actually decades. They are my colleagues and my coworkers, my mentors and my friends. They are each in many ways historians of the HIV epidemic from different vantage points. And in their own right, each are experts in their field. I extend my welcome to the panelists, who you will all meet in a moment. This virtual event is jointly presented by Gilead, GLBTQ Advocates and Defenders, and Victory Programs, two organizations near and dear to my heart, and that have deep roots here in Massachusetts and nationally in the HIV epidemic. Since the earliest years of the epidemic, in fact, these organizations have served HIV-positive individuals and their families with respect, confidence, compassion, and I'd like to provide just a little bit of background, actually, about each of our event organizers. GLAAD and its director, attorney Ben Klein, who is one of tonight's panelists, has led efforts over years to protect and advance the health and rights of LGBTQ+ individuals and those living with and at risk for HIV infection. GLAAD provides legal services to individuals living with HIV and others who face discrimination in the workplace, in housing, in healthcare, and in community institutions. Their HIV advocacy has had wide-ranging impacts, including most recently protecting the rights of persons who use drugs to access sterile injection equipment, and the assurance in Massachusetts of health insurance coverage for the treatment of lipodystrophy. Victory Programs is a long-standing leader in the provision of supportive housing to HIV-positive individuals navigating addiction. Victory Programs opened their first such program, Victory House, with its magical red door in 1978. Today, Victory Programs operates 19 innovative health, housing, and prevention programs. Victory's prevention services include HIV, hepatitis C, and STD testing and linkage to care services, and overdose prevention, education, and naloxone distribution. Additionally, they coordinate the Boston Living Center, which was founded in 1989 and is a one-of-a-kind community center for persons living with HIV that provides congregate meals, education and wellness programs, and crucial peer support services. And I'm thrilled that the BLC program director, Bill Lottero, also joins us for tonight's panel. Tonight's event is hosted by the Museum of Science, lit up in red this evening to commemorate the 32nd annual World AIDS Day, which occurred on December 1st, and to pay tribute to these two important organizations, GLAAD and Victory Programs, among others, to remember and honor the memories of those we have lost, and to remind us that our work is not yet done. Our panelists' professional bios and personal bios have been scrolling during the lead up to the event opening, so please be sure to review those so you can get to know our panelists, and they may also share a bit about themselves when they respond to questions. In addition to Bill Lottero and Ben Klein, who I've mentioned, we're also joined by the former director of the Office of National AIDS Policy under President Obama, Mr. Douglas Brooks, as well as one of the first individuals I met in this work in Massachusetts, and hopefully she'll be able to join us, a woman who's been a constant source of support and guidance to me throughout my career. She's a peer advocate and an educator and also a community leader, Ms. Shirley Royster. And hopefully Shirley will be able to join us as well. As we move into the panel presentation, please use the Q&A or question and answer function to type any questions you may have, and we'll keep an eye on those so we can pass them on to the panelists. And we'll also be posting resources that will be visible in the chat as well from the organizations that are involved. So now I'm very excited to introduce our special guest speaker, Dr. Bruce Walker. Dr. Walker is the founding director of the Ragon Institute of MGH, MIT, and Harvard. He is a world leader in the study of the immune system response to HIV infection, including the dynamics of acute and early HIV infection, I actually had the pleasure to interview Dr. Walker back in 1997 for an AIDS Action Committee newsletter about his research then into therapeutic vaccines and the ways the immune system could be harnessed to fight HIV. And today we're hearing promising news about monoclonal antibodies and preventative vaccines as immune-based therapies to fight COVID-19. Dr. Walker was unable to join us in real time for this online event, but he has pre-recorded some remarks. We asked that he share his thoughts with us about this moment in which we find ourselves and what our experiences responding to HIV can teach scientists, advocates, and others about the way forward in response to COVID-19. So now we'll play a brief video from Dr. Walker.
Hello and a warm welcome to all of you. My name is Bruce Walker, and it's a particular pleasure to be asked to speak to you today at this Victory Program's World AIDS Day event. I've spent my career working on HIV, a pandemic that emerged around 1980. At that time, it took us 4 years to figure out even what the cause of this new disease was and to develop a diagnostic test. And 40 years later, we're still hopeful that a vaccine that we have in clinical trials right now will be effective. In January of this year, I was in South Africa teaching a course called Evolution of an Epidemic to Harvard and MIT undergraduate students when I heard through one of the students who had just returned from Wuhan about a new disease emerging in that part of China, leading to massive hospitalizations of people with a new pneumonia of unknown cause. Remarkably, in contrast to the 4 years that it took us to identify HIV and develop a diagnostic test, within 4 weeks of the first announcement of this new disease in China, the viral cause of it had already been identified as a new coronavirus, and a diagnostic test developed. That's, to me, just an incredible tribute to the advances that have been made in science over the last 4 decades. As I returned from South Africa, I realized as a scientist, having worked on HIV, that we needed to apply what we had learned to this new emerging pandemic. And as a result, at the Ragon Institute, we immediately began working on developing a vaccine based on what we had learned about HIV. Dan Baruch, one of the founding members of the Ragon Institute, within a few short weeks had already constructed a vaccine. And I'm incredibly pleased to say that that vaccine is now in phase 3 trials with a readout expected before the end of the year. That experience parallels that of many other efforts that are underway that have already delivered 2 vaccines that have shown greater than 90% efficacy, and a third vaccine that also looks promising. And there are others to come. All of these have come because of the application of knowledge that was created by studying HIV and applying that to this new coronavirus. And it doesn't stop there. There are monoclonal antibodies that have been developed that look extremely promising. And those too build on technologies and experience and knowledge that were all gained by studying HIV. Science has incredible power to change the lives of people, to change their health. And it's science that's going to get us out of this pandemic. As we look forward and recognize the rocky path in front of us during the winter, I think all of us can be optimistic that these vaccines will work and that we will see an end to this pandemic. I think the important thing now is for us also to think about the next pandemic. We need to be ever vigilant. We need to set up mechanisms to identify these diseases as they emerge. And we need to work as a community to address the many dimensions of actually achieving the herd immunity that's needed to actually end the pandemic. It's not going to be just science. It's going to take all of us working together, scientists, clinicians, policymakers, outreach workers, all of us together. I'm sorry that I can't be there with you today, but I want to again acknowledge the Victory programs and all that they have done for so many people And again, thank you for letting me share some thoughts with you. Thank you.
Thank you, Dr. Walker. It is certainly the case that we will all need to work together to defeat COVID-19. And that really resonates with how we as the HIV community has banded together over years to respond to the HIV epidemic. And the members of our panel have been leaders in that unified movement. So I would now like to turn to them and ask that they please turn on their cameras so we can see their beautiful faces. And we will move into our panel discussion. So let's just give everyone a chance to get their cameras on. And while they're doing that, I know that this group will remember that in June of 1981, nearly 40 years ago, the MMWR published an article about a novel infectious disease leading to severe illness and death in a patient group of gay men in Los Angeles. We later identified the condition as acquired immune deficiency syndrome, or AIDS, and its cause a novel virus, the human immunodeficiency virus, or HIV. What followed in the United States included campaigns of misinformation, fear, and discrimination, often characterized by racism, xenophobia, homophobia, and transphobia. There were widespread efforts to restrict civil liberties and human rights of impacted population groups. There was a demonization of the continent of Africa and the country of Haiti as the source of a modern day plague. And arguably, there was a dangerously negligent response by the federal government at the time. Is any of this sounding vaguely familiar? Today, we find ourselves in the midst of yet another pandemic, COVID-19, and there are disturbing parallels to the early years of the HIV epidemic. So my first question to the panel is, in what ways does COVID-19 remind you of the early or even current HIV epidemic? What have you encountered in the context of COVID-19 that has echoes of those early years? I'd actually like to ask Ben to start us off. Ben, you've worked in HIV and other infectious diseases and legal protections for decades. So what issues are raised by COVID-19 for you that are similar to HIV?
Great, thank you so much, Dawn. And I'm really so appreciative of this opportunity to talk about these two epidemics that have been so devastating and have really fundamentally altered our world. I wanted to start though by actually noting a couple of the differences between HIV and COVID, because I think that's so important for us to keep in mind on this World AIDS Day week. As you mentioned, when HIV, when the epidemic first began in the 1980s, it was affecting groups that were despised in our society. And that led to discrimination and stigmatization that was so severe and profound. Doctors wouldn't treat people with HIV, children were expelled from school, 33 states criminalized HIV transmission. And that is something that still persists to this day and affects the response to the epidemic. And we don't see that in COVID in the same way. The second is that COVID, we've been living with COVID now for 8 or 9 months. I think it feels a lot longer to many of us. And as Dr. Walker mentioned, we're already talking about a cure or a vaccine or maybe turning the corner on this really catastrophic event. There are people who are living with HIV now for decades and experiencing some of them medical complications from the toxicities of early treatments, and certainly the ongoing burden of stigma. And so I just at the outset want to pay tribute to the people who've really been living with this for a long time in the world that we're in. But I think there are also really important lessons from HIV. And the one that I want to focus on for a moment is the challenge of public health prevention, which has been so stark in both of these epidemics, of getting the government to adopt the right policies and then encouraging people to alter behaviors. And with HIV, we have certainly seen how stigmatization has impeded the policies that we know are scientifically proven to keep people alive and safe, whether it's condom distribution in schools or prisons, access to clean needles, frank and inclusive sex education. With COVID, we've seen less stigmatization and more of a politicization of public health that has really impeded getting people to do the things that we know for this epidemic can keep us safe. And the final point that I just want to make at the outset about prevention, and one of, I think, the most important lessons from the HIV epidemic is we knew it in the HIV epidemic because of the marginalization of the groups affected, that judging people and shaming people and condemning people was not going to be a sound public health policy. It harmed people and it actually alienated them from the systems we needed to bring them into. And I think what's happening with COVID is we certainly see people who can't socially distance, for example, because of some of the inequities in our society around housing and employment. But we also see people who don't think COVID's a real thing, don't want to follow public health guidance. And I think the tendency, and I've done it myself, is to want to judge them and condemn them. And I think we are seeing that doesn't work. And we really need to look at some of the lessons from the HIV epidemic about how to engage communities in ways that meets people where they are so that we can get a more effective response.
Thanks. Thank you so much, Ben. I'd actually like to open it up to our other panelists. Bill, I'd really like to turn to you. You're on the ground every day working with BLC community members. I'm wondering how this experience has impacted them and the types of information that BLC members need and support. And I'm sure if, Bill, if you can turn your camera back on so we can see you again and have you respond as well. Maybe we'll give Bill another minute to get his camera back on. Wondering, Douglas, if you have some thoughts you'd like to share.
Sure. And first, thanks for having me. I think there's no secret that I am a huge fan of GLAD and Victory programs, and thank you for sponsoring this event. Ben already opened this topic, but I think the importance of addressing the inequities up front is something that is worth repeating and really looking at how we're going to work with people who are most impacted. State, and Dawn, and you know this better than anyone, state budgets are going to be further impacted. State health departments have had to overspend already on the epidemic, as well as local governments. So we've got to get a federal package out there again to be able to help people. And the importance of including community health centers and the places where people live and where they work and where they play and where they pray have to be factored into this if we're going to be successful. If we learned anything from HIV, we've learned the importance of, and I think it's timely that Bill Lottero's face comes up as we're talking about working to include communities and people who are impacted by issues and having them have a meaningful role in decision making and what impacts and what we're delivering to communities. So I think that for me, that seems like the most important piece.
Thanks so much, Douglas. I really appreciate that. And I think it's right on. And yeah, Bill's timing and getting back onto the screen was perfect. Because Bill, we really did really want to talk about how members of the community, the HIV community, are experiencing this sort of echoing of the early days of the epidemic and COVID, and particularly how they're experiencing COVID as people living with immune compromise, and so navigating the response societally, but also navigating their own responses.
Oh, I agree. It's been challenging. I would share that in March, when it's first emerged, we have a low threshold community. People come in every day. They're joined in community sharing and supporting, breaking bread together. And that is a real relational network that is incredibly important and supportive. Well, when COVID began, we had to start messaging. We're going to have to make some changes and prepare for the oncoming virus. And you probably all recall that in the early days, there were these posters, public service messages there's a poster of a child that said, "I have AIDS, but you can still hug me." And because there was so much stigma and fear of how contagion would occur for AIDS. And so when I was approaching members saying, we're going to have to use social distance now, that was almost like a PTSD for them, because that traumatized, I can't go back to where I'm pariah, where, you know, I'm toxic and can't be near you. So that was really traumatic. And we then worked to help them understand that we still have the community built, and it's going to work for us to respond to COVID. And so then we did have to do a lot of retrofit within our system. We never shut our doors. We did, you know, provide meals through to go, but quickly, as soon as masks and other technologies were available, we were unable to open up again and have community be with people. And that support has been incredibly important. So, you know, the connection from the past to now is that without community, the isolation is devastating. And it's when people become more vulnerable and more likely to be infected, where they can't access clear information about prevention. It's been, so from the member standpoint, I think they are now in sync, and I'm very happy that what we built through the AIDS epidemic, that we have created a community that is coming together and continues to support each other, is every day a moment to help them understand how to stay safe. So that's an educational moment that's occurring all the time, you know, right from wearing a mask and how to wear it correctly, how to wash hands as frequently as possible, sanitizing, etc. And when we don't have these things in play, when people are either through stigma or other points of isolation removed from coming together to support each other, we become more vulnerable to further spread.
Yeah, thanks, Bill. You know, you made me remember how it really was the HIV community. And in fact, the Living Center was a locus where so much accurate information was provided to folks in real time, when swirling around us was so much misinformation or absence of information. And it strikes me that COVID has been so different because there's been this onslaught of wear a mask, be socially distanced, this many weeks in isolation. And that's something that the HIV community had to create. Whereas now we're actually getting it more from other sources. But the question is about the trustworthiness of the source. And I think what the Living Center proved early on was that when community and peers shared information with one another, there was much more trust and faith in the quality and accuracy of the information. So it's been such a critical place, even in the context of COVID, for people to receive COVID information, as well as ongoing HIV information.
You know, I may just add that we during AIDS, we're always been talking about hard to reach populations. And that's a struggle. And often those populations, those most vulnerable, end up in other systems like the criminal justice system. We want to have conversations with people. And in the absence of the structures that have been created by community-based efforts to have you know, a low threshold community where people can come together, then we have to go find them. And that takes a lot of resource and a lot of effort and a lot of missed, you know, opportunities. By what we created, we now have a place where we can continually inform and support and encourage safe behaviors.
Great. Thank you, Bill.
You're welcome.
I'm going to move us into another question. And you've all, in your responses, sort of highlighted this. And that is that I would assert, and it sounds like you all might agree, that no group understands better than the HIV community about the intersections between an infectious disease and social determinants of health and health inequities. And I'd like to ask the panel to sort of build on what some of you already started to share about what you think the social determinants are that are driving the risks for COVID-19, and what lessons the HIV epidemic teaches us, or the response to the epidemic teaches us, about how we address those inequities now, as they're sort of being revealed in full color to us relative to COVID. And I hope that maybe Bill, you know, you might start us off again, or Ben or Douglas, sort of opening this one up to all of you, because you all hit on it.
Sure. Well, I'll take a shot. You know, I think that, you know, clarity of information and effective information, not misinformation. What you know, early on, we learned the dangers of a medical threat that are understated. and a community may not mobilize to respond to issues if they are, disaggregated. And I recall Larry Kramer's essay of 1,112 and counting. It was a turning point in AIDS, and he wrote that little of what I've written here is likely to be rectified with the speed necessary to help growing numbers of victims, but something worse will happen and is already happening. So, and unless and until we can, remove stigma and not make masks a political statement, a mask is a mask. And, it's a form of stigmatizing the use of a mask. When we hear the information that's out there, it's the same thing when we can reduce somebody from being less than a person, then we are less likely to respond socially. So stigma is a problem towards response in a grave way. And we certainly lived that through the AIDS epidemic. And we have a lot of lessons there about how not to diminish a person.
Yeah, thanks, Bill. Dan, do you have something you'd like to add to that?
Yeah, I mean, I think one of the things that really struck me in the early days of the COVID epidemic, when it became clear that there were significant racial disparities in who was contracting COVID, mortality rates, was such a sense that that we were trying to address this in the HIV epidemic. And of course, we haven't succeeded. And we're seeing the same disparities because the root problem is not the virus, it's not the epidemic, it's the structural change that we haven't achieved yet in this society, where we see systemic racism, poverty, even things like climate change are disproportionately affecting low-income people and people of color. And the need to address those systemic problems still is so glaring in our society. And I want to just add one more thing, which is, over the summer when we saw the really powerful demonstrations in response to the murder of George Floyd and police brutality, and we saw that those demonstrations actually got some attention from legislatures and policymakers to at least recognize the problem and acknowledge that we haven't sufficiently addressed it. It did bring my memory back to some of the early days of the HIV epidemic, and the need not just for lobbyists and lawyers and advocates, but the real difference that ACT UP made in their demonstrations, in their civil disobedience, in their sort of theater, where they put a giant condom over Jesse Helms' home, and it was those kinds of things that really did begin to get the attention of policymakers. But these are systemic problems that require such a multifaceted response in this epidemic as well.
Yeah, and it's so interesting to hear your response and Bill's response, because I feel like Bill was really talking about the role of community and the importance of the structures that community can bring to the fight. And you're also highlighting not only community, but how that sort of washes into policy and advocacy solutions. And one of the questions that one of the registrants for this event asked was, and I'm going to read it, what did we learn from surviving the early AIDS epidemic that can help us cope now and enable us to support and lead our communities? And I thought it was such a great question, which is I wanted to read it accurately. I don't know, Douglas, if you have thoughts about that, because I'm thinking about when you were here in Massachusetts and you were working at Justice Resource Institute and we're working with community so much, and also on the policy side, if you have thoughts about that particular question from one of our attendees.
Yeah, one of the difficult things about being on panels with people from Massachusetts is they all are good and smart and thoughtful. So I don't know that I have too much more to add. I think, and I'm not joking. I mean, I think we are a bit spoiled because the other prong or leg to that stool were bold public servants. So when we look at our own Massachusetts Department of Public Health AIDS Bureau, when you think about John Arbeck, think about Jim McGuire, you think about Kevin Cranston, think about you, people who, I remember Gene used to say, would call some of us who were running programs and say, I need you to make me do this. And by that, she meant, I need you guys to be making some noise about this to push it because I'm getting pressure from somewhere else. And remember, the boldness of, because I think with this, just as with HIV, and we had to learn it all. We know this now. You have to over communicate. You have to ensure that language is accessible to all. And I mean culturally, ethnically, but also literacy levels and the images. I remember walking one day into Kevin Cranston's office, and his entire floor was covered with literature because, and we love him now and he's doing good work because Governor Romney had summoned him to the office and wanted to see every single piece of literature and image that the Commonwealth taxpayers had paid for. And, and he got through it, but it takes bold, it was bold. Some of those images that we put out there so that people could see themselves and understand that the disease was relevant to them and to their lives. And I think we have the same situation now. We have to ensure, and when we get the message right, we have to ensure, and Ben said this, that we have the right messengers. Who's carrying these messages out there so that people believe it. And also in the structural way, I read something, it's actually a woman from the Kennedy School, I think, was saying, yes, we see these inequities and disparities among Black people, and some of it is because of comorbidities. She said, but it's also because people live in overly crowded public housing. They leave that and get on overly crowded public transportation to go to overly crowded workplaces where they have no say about spacing and distancing and all the things that we know are important to be able to address the epidemic and really make a difference. And so where we can't agree with what has been said about the structural, systemic barriers, where we can't change those or eliminate those, then we really have to be vigilant about how we get around them and ensure, and I do, and this is not to make all my loved ones in Massachusetts feel good, I really do believe the Massachusetts model is what should be used throughout the country in addressing this.
Thank you, Douglas. We'll take the compliment. That's okay. I don't know if Ben or Bill, you have any more to add, after hearing, especially you, Bill, after hearing Ben and Douglas, or Ben after hearing Douglas and Bill.
I just want to follow up for a moment on something that Bill said, because although I am a policy person, I remember the early days of the epidemic. And I think that there were some things that were critical that we haven't yet figured out how to do in the context of COVID, because as I think Don and Bill and Douglas have all said, we really invented in the community the infrastructure of support. That came from the community, not from the government in the first instance. And I do believe we need massive government assistance to get through this epidemic. But beyond that, in the early days of the epidemic, we had support groups, we had transportation programs, we had programs that delivered meals to people. We had emotional support programs. We had even programs that, help people walk their dogs and take care of their pets. And there was this sense of a communal response that brought people together to help others. And I think the challenge of COVID is that it is, because of the way it's transmitted, it is fundamentally an epidemic that separates people. And yet I think that there needs to be a lot more thought given to the creative ways that we thought about supporting our community in the early days of the 80s requires a very different kind of response today, but I don't feel like we have yet done that. There are certainly some efforts, there absolutely are, but in terms of a broad-based communal support system for people in their neighborhoods, in their cities and towns, we haven't done that. And I think that it's really something that cries out for help. And hopefully in a new administration, some government grants and supports to seed these kinds of programs. And that will be as important for vaccination efforts as it is for caring for people who are directly impacted now.
Yeah, it's so interesting, Ben, that you highlight the sort of value of the HIV service infrastructure, because in fact, early on, as the COVID response in Massachusetts was being developed, we did partner very closely, the Office of HIV/AIDS and the Bureau of Infectious Disease and Laboratory Sciences, to deploy the HIV/AIDS service system, both on the prevention side to deliver expanded SARS-CoV-2 testing to vulnerable populations, and on the care side, programs like community servings that do home-delivered meals still for people with HIV and other chronic infectious diseases, started to do meals delivery for people who are isolating because of COVID, because it was a ready, competent, compassionate infrastructure that was in place and had credibility with community. So they didn't have to build all that, they had it. And it turns out people who are impacted by COVID don't look that different than populations who are impacted by HIV for all the reasons you all have been highlighting in terms of the social determinants and vulnerabilities that communities experience. So it is really interesting. And something else you said, Ben, leads really nicely into our next question, which is that our country, as you all know, has just been through a historically tumultuous and polarizing election from which we are all still recovering. If you all were in a position to advise the newly elected President-elect Biden and Vice President-elect Harris, and their administration about one lesson from the HIV response that you recommend they apply to the ongoing COVID-19 response, what would it be? And maybe Douglas, given your relatively recent proximity to the White House, we could ask you to start and then go to Bill and to Ben.
Yeah, so I'm actually excited about what's happening. Vivek Murthy, who was the former Surgeon General with whom I worked very closely, is co-chair of the COVID task force. And for people who don't know, Vivek and his sister actually worked in HIV together. They developed some program, and so he does understand HIV and how what we've done could be helpful. I think, and I sound like a broken record, but this is where my head is these days, and it's the work that I'm most interested in. Is I would say back in April. Dr. Fauci was at the podium, and Tony said they had just gotten some good data back, and he said, we are going to get to the end of COVID. We will find a way to end this, but when we do, we have to come back and pay attention to these disparities that continue to plague the African American community. And were I to say, have the opportunity to sit down with the president-elect and the team, the first thing I would say to them, use this opportunity to truly tackle these inequities. It's not like we don't know what we need to do. It really isn't. And I think Ben spoke to, and there were people who didn't know. I have more white people in particular, say to me, because they were sitting home, sometimes they had their televisions on, this was in their face, the murder of George Floyd was in their face, but also just really seeing the data about these inequities in COVID-19 was in their face. And people said, I didn't know. And what I say is, and now you do. And so I think the most important thing that can happen is for us to really use all the systems that we've talked about, the federal system, state and local government, communities, community health centers, all these things where people live, reside, and interact to truly end these inequities. And we're not going to undo 400 years of racism in the United States of America, but we truly can make a difference in how our systems are accessible to and responsive to the needs of the people who are disproportionately impacted over and over again. I always say, we Black people get everything first except the money. And so it would be really nice to see something that addresses the inequities.
Thank you, Douglas. I wonder, Bill, if you want to respond to that at all. I feel like the Living Center has been such a strong force for fighting for health equity. If you have any responses or thoughts to share.
I certainly do, and I think what Douglas was just saying is really right on point. I do feel very optimistic, actually, for where we're about to go. But I do want to connect the through line. From the beginning, there was no federal response to AIDS. There was a denial of its importance or its existence. And it created the need for localities to respond. And so, San Francisco County, they shut down the bathhouses because they had determined that was a source of infection. So that was a local response. And then, gay men's health crisis in New York emerged to respond. The Boston Living Center and AIDS Action emerged to respond locally to do something in the absence of any federal sort of clear. I think it's always been a super important aspect of the federal piece is to produce clear prevention and education, messaging that helps people be aware there is something that really is important and that we're going to support doing something about it. And then for localities to nuance that and create something that's particular and relevant to where that place is dealing with and who they're really grappling with. So, that didn't emerge for many years in the AIDS epidemic, and then finally did it with the Ryan White Care Act. It was an interesting and very innovative piece of legislation because it did create federal dollars and large, broad swath policy guidance. But it said that part of that guidance is that locality knows what it needs to do and how to orient its delivery system to respond, and we're going to give you the money to do it. So the federal one had some CDC and HRSA ability to say, there's some broad message here, but then here's the money to make it local, to penetrate into the hard to reach points and make it real for people. And obviously the Ryan White Care Act was particularly important in saying, responded to the Denver principles that also emerged in the early 80s. It said people who are infected must be at the table at all times. And out of that awareness and policy support, then localities and local groups did respond and would have the resources necessary to do it. And then you see Gay Men's Crisis, the Shanti Project emerges, and the Boston Living Center. We were able to build things that would otherwise just not be here. Similarly to today, back then, we were afraid of an overwhelming the healthcare system, and we had to respond. And yet we had to recognize locally that stigma was in play, marginalized communities were not going to have access. So we had to actually create a parallel service delivery system and attach it, sort of append it to our existing system in order to make it work, to make it relevant and actually engage the people we really want to reach. It's always been from who are they, meaning who's infected, where are they, and why are they not in care? And we had to do that locally, design systems that responded to the locality of it. And the federal response was there to do so with the monies. We see it today with the misinformation and a lack of continuous, funding efforts at community engagement for COVID. that is plaguing us. And hopefully now with the election, we are now able to transition to something that will provide prevention education messaging, which is clear and consistent, and that localities will have support to, build from it and make something relevant.
Yeah, clear, consistent, and the point you've all been making, delivered by the right people. And I love that you mentioned the Denver principles, right? Nothing for us without us. And really being able to be consultative with folks at the local level, population, community level, but what they need. Ben, any advice for President-elect Biden?
Well, I think if he listens to what Douglas and Bill have just said, we'll be in really good shape. But I just want to add two quick points, just following up really on what they've said. And the first is, as Douglas talked about, the sort of, if you didn't get it before, do you get it now kind of point. And I think what may give us more hope about some greater change coming from the COVID epidemic is that people can really see the interrelationship between systems that are affected. So it's not just healthcare or healthcare access, but it's housing patterns and education. I mean, we're seeing more than ever because some children and students have access to remote learning, others don't, where people are understanding in a much more concrete way the disparities in education funding and poverty levels and the impact of wages and the kinds of jobs people work in and the kinds of protections they need. So I think that there's an opportunity, at least, that I hope we don't squander, for people to see how all of those systems interrelate in these kinds of disparities. But the other thing I think the president will get, but I want to make sure he does, is it is, I think, one of the disconcerting things and there are so many disturbing things that have come out of the last 4 years and then the response to this pandemic. But one that, to those of us who've worked in HIV, can't help but probably think of all the time is the sort of anti-public health, anti-science mindset that that the administration has fueled and has really done a lot of damage to the infrastructure of disease prevention and sound health in our country, and to the point where some of these institutions that have been so core have, their integrity has been questioned and trust in them has been questioned. And I do think there needs to be some kind of concerted effort beyond just putting good people into place to really help people understand the importance of public health and science.
Yeah,
I just want to amplify that. I think Ben is so right. It is, as much as I hated the campaign slogan, "Build Back Better," it is exactly what has to happen. We have to rebuild the systems, the infrastructure, but first and foremost, public trust. And that is going to take a lot. But I think it can be married with, and here I go again, I think it can be married with addressing the inequities, right? If you got the right people out there saying you can trust these systems because they are built back better for you, we could really find ourselves 4 years from now in a much better place than we are, and better than we were even 4 years ago. But it will be very important, and I think someone mentioned earlier the part of what I most love about the movement was that it was begun by these people who were just like, you will not dismiss us. We will not be dismissed. They were also very empowered, often white gay men who had training and law degrees and various things, and they were fighting for the lives of their communities, and certainly also stigmatized for being gay and being queer. So I don't want to minimize that, But when we look at some of these communities that are so beaten down and so marginalized, we have to also think about ways to have those communities, those people feel the power and the sense of agency to fight systems and go after it. And I do think, I think what we see in some of these young movements, we see that energy. And so, yeah, I think.
Yeah, no, that, it's interesting as you're both speaking. A couple of questions have come up in the Q&A that relate specifically to stigma, and sort of managing that. One is, do you think we will have to deal with long haul COVID issues, people who have, long-term consequences of having had COVID infections that are similar to what people with HIV and AIDS deal with relative to maybe benefits like insurance and employment and things like that? So Ben, maybe that's something you can talk about. And then another question from a very old friend who I haven't heard from in a long time is that it would be wonderful if the panelists could talk about ways we can address COVID stigma and shame, especially to support, prevention and prevent transmission. So I wonder if that's like a more legal question for Ben about long-term consequences, and maybe a more sort of community question for Bill. So I don't know if Ben, if you want to start, like, is it possible?
I think it's interesting because as I was thinking about this panel, I really was struck by the fact that, there haven't been a lot of legal issues per se that have come up in COVID. There've been a few, but not like we've seen with HIV, where there were just so many questions of legal protections and privacy and insurance coverage and all of that. And I do think it's possible we will see things down the line in a couple of ways. One is, I do think that we may see insurance discrimination against people who've had COVID. And I'm not talking about healthcare, because we've got pretty good reforms around that, so I don't want to alarm people. But in areas like life insurance, disability insurance, we've seen still existing discrimination against people with HIV and exclusions. And it wouldn't shock me if we saw some of these companies saying, we're not going to provide life insurance or disability insurance to people who've had COVID because the long-term consequences of having had COVID are unknown. And the sort of mantra of the long-term consequences are unknown is like it's the mantra of the insurance industry. And I hope that's not the case, but I think it's something we could see. I also, at the very beginning in April, when I think we thought we were gonna be out of this sooner, people began talking about having your immunity passport to go to work. And that just raised all of these questions about, tattooing people with HIV, which William Buckley suggested in the 80s. And I do worry about disparities in getting the vaccine to people who need it, in those who may not have had the vaccine, and some kind of discrimination there. But it's so new that I think those are things that we have to wait and see.
Mm. Bill, do you have thoughts about the stigma question in terms of people who may have had COVID or not currently, or probably not currently dealing with, people who've had it and impacts they're dealing with long term, and also this idea about getting the vaccine or not?
Absolutely, and what Ben was mentioning is super important to like what we've been doing through the years of HIV and AIDS is building awareness that you have to engage people where they're at in life. We had, just before the COVID experience, we were all grappling nationally with the drug epidemic. People who were just working day, people who got pain and they decided to use pain meds and then fall into addiction. So we need to engage these people. The AIDS epidemic in enlightened areas, not everywhere. We know there was an outbreak in Indiana because they wouldn't do needle exchange. And that was an interesting awareness for the governor, vice president, that, wow, I should not stigmatize drug use because I can have other, wildly out of control fires of virus spread. So by what we've done, particularly in Massachusetts, and I remember when John Auerbach and others were just trying to put this together and allowing mayors to opt in or opt out. But if you thought to do this, we would provide needle exchange capacity. At the Victory Programs Boston Living Center, we have that. So we take you where you're at, and then through that engagement can get you towards health and well-being and make choices towards sobriety. But if I stigmatize you and push away and say, not until you're clean and clear will I engage with you, well, then we're going to have a whole bunch of people out there who are not going to be vaccinated, who would not be using that, who are going to continue to be spreaders of COVID. So what we've built, we ought to be using, which is that we have ways now, because we were thoughtful, to engage people where they're at. And we should really leverage that power. I think the Boston Living Center is a model of that in a harm reduction, low threshold. You can come in, we'll take you where you're at. And through that engagement, we're educating you. We hand you masks as you walk in the door. We hand you hand sanitizer. We talk about this on a regular basis. So that's where now when vaccines come out, well, we have to find those people who would otherwise be on the street maybe, but they're going to come in here for a meal. They're going to come in for a support group or whatever they need, some, personal care equipment. We give it all. So, the homeless, the at risk of homelessness, the food deprived, drug use, all of those social conditions, we push it away. How do we reach these people to get them a vaccine, to keep them from getting infected at all? So it's in our best societal interest to engage these people and have the conversation through trust building. And that's where we're going to make it.
Yeah. And I think that, Bill, that's a really kind of important place to end as we're heading towards the 6 o'clock mark, and our hour went quickly. I'm going to ask each of you to share sort of a closing thought. But Bill, what you're saying sort of reminds me of what Dr. Walker shared in his statements, which is we're all going to have to come together with compassion and with the same kind of values that we brought to our early response to HIV. And that is we have to care for each other, and we have to listen to each other. And we have to fight for each other. This is going to be a fight. And I agree. I think we have to listen to community to figure out how to do it right. So I want to just give Douglas, Ben, and then Bill, just closing thoughts you'd like to leave folks with who are listening. We had over 125 people listen in, so that was great.
And still over 100 are still here. So we must not have bored them too terribly. And just because the voyeur that I actually looked in the participant list. And I think the last thing I would want to say is to all of you who I know, and there are many of you, thank you for the work that you do for helping to build the systems in Massachusetts that truly have served as a model for the country and even the globe. And I'm just so sorry that Shirley had technical difficulties, because her voice and her thinking would have been additive for sure. And so I just want to raise her name and send some love her way. And this has just been a wonderful opportunity to have a conversation with you folks.
Thank you, Douglas. We do. We love you, Shirley. Ben, closing words?
Yeah, I actually want to close with something not lawyerly, but very personally important to me. And I always tell people I burst through the closet door in 1979, just a few years before HIV came on the sort of into our world. And it was a time in our community where we were building community, we were creating community institutions. And even though it was a devastating world in many ways, it was a world in which people really came together in many ways. And I think the one of the harshest things about COVID is that it's an epidemic that has separated people. And I think that my hopes for getting beyond this epidemic is really around connection and community, and the people in my world and in all of our worlds that really want to be connected to each other in ways that COVID has really made more difficult.
Bill, any other words you want to share?
Sure. I just closing. I really enjoyed being on the panel and being with Douglas and Ben and Miss Shirley as well, and of course you, Dawn. I would say two things. I mentioned this on World AIDS Day to our membership during our lunch hour. And just to remind us all that we stand on the shoulders of so many that came before us. And today, when we're looking for help and solutions, remember that we are the ones we've been waiting for. We're here and we can do it.
Thank you, Bill. Super inspirational words to leave us all with. So I'd like to, we've reached the end of our discussion. I'd like to thank our panelists again for spending this time with us and sharing their experiences and insights. And just like to remind our panelists, if you'd like to, you can close your cameras at this time. I'd also like to thank our audience members for attending and participating in this really important conversation. The panel has been recorded, and a link to the recording will be sent to all of those of you who registered in a follow-up email. And additional information about victory programs and GLAAD and the Museum of Science can be found on the closing slide, which will come up in a moment. And so depending on where in the world you are zooming in from today, I wish you a good evening, a good afternoon, or good day. And thank you very much for being a part of this event. Take care.